Happy 2014. It's Christine, just doing an update. I'm going to talk about, first and foremost, my medical recovery from the last video I did about being left alone for 17 hours in bed, kind of propped up like I'm watching TV. I don't know if everybody knew about it, but it happened, and I suffered from it. And about a week and a half after that, when I was going to celebrate my family Christmas party, about 4:30, I had a brand new caregiver, never worked with her before, drop me in my bathroom head first onto the tile floor, head and then shoulder, left, which is my worst side. So, as a result of that, actually, as a result of the neglect in bed, I was put on 20 milligrams of Percocet every 4 hours. So that was what, December 9th? December 21st was the party. And here it is, January 12th. Anyway, the good news is I'm feeling a little bit better. Bad news is it took a long time to get better. My New Year's resolution this last week was to taper off on the Percocet because it was affecting my breathing, and my gut is totally bloated out. I look 5 or 6 months pregnant, and it's very uncomfortable, and it's something I'm going to have to address pretty much immediately. So first things first was stop the pain medication. I tapered off to 1 Percocet every 4 hours, and then the last 2 days I skipped 2 of my doses and just took 3 doses of the 5 milligram. So I'm trying to get back to where I was before the fall. The pain is horrendous. Thing that the 2 Percocets, it made me feel better, but I couldn't breathe. I mean, my breathing is so shallow. My breathing is getting worse all around the board. I started vaporizing marijuana back in December, I think. Is the only other thing that I take besides baclofen during the day. Otherwise, I sleep late. Got my new wheelchair. You can't really see it. It's got a little, barely can tell, but if I lean back, there's a little head contraption where you can tilt. If I just move my head, I can tilt my chair and drive. The electronics are really sensitive, so it's been taking practice and getting a molded back with some chemical that makes it kind of like memory foam. I haven't done that yet. And vocational wise, I haven't started back to work. I have been getting massage therapy once a week ever since the fall. So that's been helping. My massage therapist refers to my chest area right underneath my armpit, my left side. You can tell I'm leaning on my left arm right now. is feels like wood, he said. It's that hard. It's just solid muscle. All my muscles are in my body are contracting. And I'm sitting here looking like a normal chick. My biceps are so tight. My muscles along the side of my arm feel like, he said, that they're just cramped. And so it's really messed up the ligaments, tendons and ligaments in my elbow. So I'm going to get physical therapy starting next week, I think. And I'm going to have them help. I've got some goals for the new chair. One of them is to be able to, let's see, I'm trying to do it, sit back by myself. It's a little hard to do without tilting, so I can't really do it in front of the computer. But I want to be able to get back and sit up by myself and be able to control my different options on my wheelchair, which I've been getting better. So, spirit-wise, I am not looking back. I'm looking forward, because looking back, it was a painful 2013 for me. And my personal life ended very badly with a good friend. Rejection sucks, no matter which way you look at it. I am going to be getting together with, having a party this next week with my caregivers. I'm going to try to play a game called Fact or Crap. I don't know. I've never played it. And then I think right before Super Bowl, I'm having a bunch of people from Alaska Airlines stop by and see me. Part of the reason that I'm doing this is because my body is doing the opposite of what my spirit wants. I'm being nominated for an award and featured in a planner for the Department of Vocational Rehab for accomplishing 5 years of work at this certain company. My challenges with waiting for a new wheelchair set me back. Having a roommate set me back. And then being dropped on my head and abandoned set me back. So I'd like to get back to work. I have a great job, easy job. As soon as I can get control of being in my wheelchair independently, I'd like to be able to stay up by myself again instead of being in bed every night. Because right now I'm in bed from 5:30 till 9:30 every night. And then from probably midnight till 9:30. It's too much for me. My body turns into a solid rock. Again, very hard to explain to somebody that looks like pretty normal. You know, to even get your head wrapped around my lung disease, you'd have to watch several medical videos. It's not an obstructive disease, it's restrictive. And that means the volume in my lungs are not filling with the capacity because of my scoliosis and my diaphragm and my abdomen distension. So I get breathing tests on February 18th, and I'll find out if I've dropped below 30%. Last year I was 38%, and then I watched my video from last year because I keep a private journal. I sounded a lot better. I was able to, my quadriplegia was a lot better. I could hold a telephone, I could drive my chair, I could manipulate my air thing that I'm supposed to be breathing on, like right now that I can't even reach. So I got some occupational and physical therapy issues. Press forward with that, and if my breathing goes too low, I don't know if I can survive on breathing. I'm not using the breathing equipment I'm even supposed to, because most of the time I'm on a shower commode chair, which is not equipped with breathing. I don't have a husband. I don't have 24-hour care. So, basically my pulmonary doctor with, my breathing, my digestive, and my muscles, and my neurological progression with my quadriplegia. My pulmonary doctor is like the head of who makes the decisions. And he, at this point, suggests that I use the breathing machine. There's people that can extend their lifetime by staying on that breathing machine. I just don't find myself physically, being a quadriplegic, it's going to be hard. I don't know how this progression's going to pan out. I normally get my 100% medical, which includes my home care, through the Health Care for Workers with Disabilities program through DSHS. Well, I did get approved for another year, but I just got a thing for my medical saying that it was not accepted or something, so the case manager either screwed up or they've discontinued the program. I don't know. So I gotta deal with that next week. I know this is a long video, but I'm just telling you how I'm doing medically, mainly. I'm frustrated with my home care and the agency and all that whole ball of wax, so I'm not going to even get into it. Anyway, I want to wish everybody a Happy New Year, and go Seahawks. I'm a Seahawks fan, and hope we get in the Super Bowl. And I also am a big Olympics fan as well, so I'm hoping that keeps me pressing forward. That's what I always tell everybody, keep pressing forward. It's the only way we can get through this. And each time we have setback, we just got to keep looking forward and pray that, the next step will fall in place. So that's where I'm standing. Anyway, Happy New Year. Bye.